you. It is a great opportunity for me to introduce you our great speaker, Becky McCerery. If you are not familiar with her, so she is a physical geography postdoctoral fellow at Northumbria University, and her research is focused on physics, geochemistry, microbiology, and she would like to understand better the subglacial environment. Her today's speech is about best practice and intervention for accessible fieldwork, and it's quite important topic that is not so often discussed. So I'm very honored and grateful we have you here, Becky. So please, you can start. Stage is yours. This virtual stage is yours. So let's start your talk. And also thank Michelle for organization of all of this, and of course, COMNAP Andrea Colombo.
All right, that's great. Thank you, Iva. And again, yeah, thank you for organizing. I'll just share my screen. Can you see that all right?
Yes, we can see it. Perfect.
Fantastic. Okay, so again, hi everyone. I'm Becky. I'm a postdoctoral researcher at Northumbria University. And today I'm going to be presenting some best practice and positive interventions for making fieldwork more accessible. So I'm focusing particularly on sort of menstruating people. So there will be some focus on period and period management later on in this talk. And I'll also be covering toileting procedures that we operate in remote Arctic and Antarctic settings more generally. So I want to start by saying that all of these ideas were developed alongside and in conversation with other academics and those working in field-based professions. So that's to say this is a non-exhaustive look at some of the many barriers to field work and the outdoors in general that people may experience. So I'm always interested in hearing other perspectives and advice that we can share to sort of open up some more of these conversations. Ultimately, the main goal of this kind of work is to foster some more communication and then trust between employers, employees, collaborators. That means people feel comfortable accessing help and support, as well as asking for potential adjustments as well, either pre or during fieldwork deployment. So a little bit about my background. So I'm an early careers researcher working at Northumbria University. So I got my PhD in 2022 and I've been working as a postdoc since then. My research focus is polar biogeochemistry and geomorphology. And that's allowed me to be part of a number of different field teams in different formats. So I've worked mainly in the Arctic, primarily Svalbard and Greenland. And I've been part of small and large teams from remote winter camping to small research vessels. And I've also worked as a visiting scientist on larger cruise ships as well. So a lot of different varieties of fieldwork settings to kind of draw experience from, but also speak to other people and other field workers that have had different kinds of experiences too. So the overall goal of this seminar is to raise awareness and provide tools to support inclusive fieldwork for fieldwork leaders, attendees, and their teams. So as we know, remote polar environments present very unique challenges to everyone involved. That might be quite individual. So raising awareness and providing tools to support inclusivity on the whole in field science is an important step to promoting and retaining a diverse workforce, which really helps to enhance our science and our ideas. The topics I'm going to cover today are some of the inherent barriers to remote fieldwork. This is going to be quite a short section because I really want to try and focus on some of the interventions that we can put in place instead, and then to allow a little bit of time for discussion at the end. So I'll then talk a bit more about how we can design inclusive field camps, particularly around toilet access and menstruation, and then how we communicate that with our teams before deployment. And then the last part of this talk will be some more practical tips on managing menstruation in the field. So things like packing a first aid kit to the different kinds of menstrual products and how they impact on disposal and your overall sort of wearability. So overall, I think on the whole, we are doing better at highlighting some of the issues around inclusivity in fieldwork. There's already been a lot of fantastic work done here on a lot of the taboo topics around scientific fieldwork. There's a ton of resources out there around sort of toileting and menstrual health on fieldwork. But I think part of the problem here is that it's only people who know to actively look for these resources that can easily find them. So it's taking a lot of sort of proactive approach that allows people to be able to find these resources. So I think something that we're trying to encourage a little more with this work is the incorporation of these tips and tricks into things like standard operating procedures to try and formalize some of this information. So for far too long, we've relied on team members and team leaders sharing their own personal experiences, their own personal tips for handling these kinds of taboo topics. And this works great for some, especially if you're lucky enough to be part of a team willing to talk about menstrual health and toileting, which has generally been my experience. But if we can start to formalize this information, it kind of takes away that element of the luck of the draw, and it allows people to start to think through some of the practicalities of going on remote fieldwork before they go out there, which can really reduce a lot of stress. And for many field scientists, their very first experience of working in truly remote environments, so away from running water, showers, and flushing toilets, comes not as a seasoned professional, but during their studies quite often. So that might be while conducting a master's project or a PhD thesis, or generally just quite early on in their career. And what makes this quite challenging is that knowing what to expect is rarely intuitive. So I found every time I go to a different place on fieldwork, the challenges that we experience are all completely different. Instead, we're often really relying on kind of a patchwork of knowledge that's built from past outdoor experiences, sort of personal experience, as well as advice and stories passed down by more senior field workers. But not everyone comes into science with the same background. So some people may have grown up camping, hiking, and just generally spending a lot of time outdoors. They then may have grown or developed in their confidence, physically navigating the terrain, sort of staying safe in different environments, planning for contingencies, whereas other people may have not had the same chances. So what might feel like the basics to one person can be completely unfamiliar to another. So even something as simple as the language that we use in outdoor spaces can sometimes be exclusionary or at least unintuitive. So take the idea of a wild wee. So for some people, it's second nature. It's barely worth mentioning how to toilet outdoors. But for others, it can be a real source of uncertainty, embarrassment, and then at the extreme, quite a lot of anxiety as well. And if we assume everyone is starting from the same point, we then risk leaving people unprepared and adding unnecessary stress to an already demanding situation. So the least we can do then is start to prepare our colleagues and students before they go out on fieldwork, not by assuming a level of prior experience, but by going back to the very basics. So that means providing practical, clear guidance for everyone, ensuring people know how to manage both the physical and the social aspects of fieldwork as well. And if these challenges exist in what we would class as sort of the more routine kinds of outdoor work and remoteness, they become even more magnified when we start talking about the more isolated, confined, and extreme environments of the poles. When we take science and exploration to the extreme, so working in these ice environments such as Antarctica or the remote Arctic, we're really pushing sort of the limits as much as we are scientific boundaries. So these places are uniquely challenging, not just because of their physical environment, but also because of the way that they test our mental resilience and often the social cohesion of field teams as well. So if we take, for example, the light changes in polar regions, so we have months of continuous daylight followed by months of continuous darkness. And these extreme cycles can wreak havoc on sleep, disrupt circadian rhythms, trigger mood fluctuations, and it can also impact hormonal imbalances as well. So for some, that might mean insomnia. For others, maybe seasonal affective disorder, and potentially for menstruating people, this can also disrupt the regularity of their cycles. So addressing this requires proactive strategies, so access to light therapy, flexible work and rest schedules, and then creating a culture where sleep is protected as a resource. Because when one person is well rested, the whole team performs a lot better. But then there's also the environment itself, which we definitely can't start to change. So extreme cold sometimes can take a toll on sort of circulation, hydration, metabolism, and it's something that we can control is things like high quality thermal clothing that's tailored to diverse body types. So typically we see the polar fieldwork that people are kitted out with or that are generally developed, they tend to fit sort of a medium or a median body type that goes to those field settings, and they're not developed for a more diverse workforce. But ice environments can also bring rare and profound positives. So the sort of satisfaction of sort of solving problems under pressure, the deep sense of achievement that comes from thriving in a place so extreme. These moments not only strengthen your mental well-being, but can also reshape how we see ourselves, building confidence, resilience, and that sort of thing. So if we want remote polar fieldwork to be more accessible, we need to recognise both the challenges and the opportunities. It's about building systems that will protect health, promote inclusivity, and celebrate sort of the shared human experience of working in these really extreme environments. So how do we go about designing field camps that are truly inclusive, particularly when it comes to menstruation and toilet access? So too often camps are set up with a survival minimum mindset. So somewhere to cook, somewhere to sleep, and just enough toilet facilities to scrape by. But when those basics don't account for everyone's needs, the burden falls on individuals to sort of try and make that work. And that can mean people managing menstruation in potentially unsafe or unhygienic ways, avoiding hydration to reduce bathroom trips, or quietly carrying the stress that could ultimately affect their performance and their overall well-being. There are some things that we just can't change or we have limited control over in these remote field settings. So the availability of potable water, the extreme cold temperatures, but we can help to improve the group dynamics and encourage field workers to communicate their needs, which might help to sort of buffer against some of these extremes. So one thing that we can encourage is talking about toilet etiquette and hygiene pre and during deployment in a very sort of open and frank conversations to try and ease into that conversation and give people an idea of what to expect in advance to reduce pre-fieldwork stress and anticipation. Some of the very real consequences of not communicating and preparing field teams for the soil situation before field work includes things like an increase in overall stress and potentially discomfort from trying to anticipate and prevent having to go to the toilet. It's not uncommon for people to try and manage their fluid intake to avoid needing to urinate outdoors. It's particularly common for people who need to squat to pee, especially. So where there's minimal toilet facilities or in landscapes that provide little cover, it can feel even more embarrassing. So restricting fluid intake, we know, is inherently very dangerous, can lead to dehydration, infections, but it's also important to remember that managing that fluid intake to try and avoid having to go to the toilet is not a sign of ignorance, but it rather reflects how much anxiety and stress is associated with field toileting for some people. And toilets, I think, are probably one of the main sources of a lot of anxiety on field work. And where toilet facilities aren't available, we should really be having a lot of discussions about how to wild wee and waste in that particular setting. So I think it'd be really helpful to include a very basic guide of what is expected of toileting outdoors in pre-deployment paperwork. So some practical tips depending on the environment can also be really helpful. So for example, these are the tips provided on the Antarctic Glaciers website, which describes quite explicitly how to toilet in general outdoor settings. So this isn't necessarily applicable to some extreme environments, especially working on the ice, but something along these lines or more bespoke to your particular field site can be a great addition to a pre-deployment meeting, particularly where maybe field guides may not be present or covering these kinds of issues. The main takeaway here is that this guidelines need to be quite explicit. So really describe what the site's going to look like, what the toilets are going to look like, and then how to dispose of all of the necessary waste. So as a field organizer, a few of your options are the first thing you want to do is to just be clear about what the toilet situation is before deployment. There are potentially going to be people out there that just won't outright be comfortable with maybe what that situation is. And that could be because of a medical condition or personal reasons, and this should be respected. But to do this pre-deployment, it gives people the time to maybe talk through some concerns and change their mind, or withdraw with enough time to allow someone else to step in. Once those lack of facilities have been acknowledged, it's good to get everyone involved in the conversation about what toileting is going to look like for the team as a whole. So is it something really basic like a bucket with toilet seats, and then how to go about using those and where to put your waste? It might be something even more basic like a tented hole in the ground, and discussions need to be had again about things like toilet paper, waste products like disposable menstrual hygiene products, that sort of thing. So what can camp actually look like? So for toilets and menstruation, privacy really matters. So designated, sheltered and hygienic space is the ideal. Waste management systems need to account for menstrual products as much as they do for things like food scraps and general trash. So this means sealed disposal options, clear guidance and culturally sensitive protocols. So where possible, provide options. Some people may prefer a personal disposal kit. Others may need more communal facilities in an emergency. So both of those things should be safe, private, and non-stigmatized. And then ideally sort of access to clean water, even in small amounts, for hand washing and basic hygiene. That can really reduce sort of general infection risks across camp, but also anxiety around managing menstruation. So stocking menstrual products as well as part of a standard field supply kit, just like we would toilet paper and first aid items, that really signals inclusion and takes a lot of pressure off individuals to potentially over-prepare. It also signals a nice openness to discuss menstrual health and any potential concerns an individual may have before deployment, but also whilst on field work as well. So as fieldwork leaders, it's important that we set the tone by cultivating an atmosphere where everyone feels supported to urinate or use the toilet when they need to. So a very straightforward, matter-of-fact statement at the start of fieldwork goes a really long way in normalizing this, reminding people that looking after their basic needs is not just acceptable, but it's also expected. So providing some clear resources and explicit guidance on what toileting and hygiene facilities will be available is really important. The more information people have in advance, the better prepared they are, both mentally and physically. We want people to be able to plan for themselves, bring what they need, and then early clarity really helps to reduce stress and empower individuals to manage their needs with confidence. Once in the field, keeping that discussion open, encouraging questions is really key. So I always say to assume less prior experience rather than more, but to treat everyone equally in these conversations as well. So no one wants to feel singled out as the inexperienced novice in front of their peers and their seniors. So by taking a sort of more supportive, inclusive approach, we start to build a lot more trust and set the foundation for a healthier, more effective team. So I'm now going to focus more on menstruation for the last portion of this talk. So I want to start by saying there's potentially quite a lot of misinformation out there around sort of the physical performance around periods and menstruation. And I want to preface this by saying there's no reason why staff and students can't perform at their best at any point in their menstrual cycle. So not everyone will have what they classify as sort of troublesome side effects or troublesome periods, but we want to support people to be able to practice menstrual hygiene in the field and deal with any of their personal symptoms so that they can be comfortable, regardless of what conditions they might have prior. So although menstruating people have to navigate their periods regularly in the workplace and their personal lives, having access to extra support during remote field campaigns is really important for comfort and dignity because it's able to ensure access to adequate menstrual hygiene products, private sanitation and rest, which can really reduce a lot of the shame and stigma that's still seen around menstruation, especially in mixed gender teams. So empowering menstruating individuals to focus on their science and not their discomfort is really the key here. So managing menstruation effectively in extreme conditions also helps to prevent infection, dehydration, and potential complications like toxic shock syndrome from improper product use. Prolonged physical comfort also directly contributes to emotional stability, reducing anxiety around having to manage your periods in these isolated settings. So by fostering a sort of menstruation inclusive field culture signals that women and gender diverse individuals are welcome and supported. It can lead to sort of higher recruitment and retention. And when individuals are comfortable and healthy, team cohesion and performance really improves, which drives better collaboration and enhanced field efficiency. A supportive team in general in these environments really boosts morale for everyone, reducing potential burnout and improving your overall expedition success. Non-menstrual team members may be unaware of the challenges faced by their menstruating colleagues, and they might be unsure of what small changes can be made or policies to be put in place that could ease that burden. Unfortunately, there's still a significant amount of stigma around talking about periods and menstruation, and this makes it difficult for menstruating people who feel uncomfortable or embarrassed to ask for adjustments. And this is especially true for new field workers and underrepresented groups who have less experience and less access to resources than more seasoned professionals. So I personally learned everything that I needed to know while on field work with other menstruating people, which is great that we were able to have those conversations. But because they happen privately, it sort of perpetuates this luck of the draw and unequal opportunities, as not all teams will have that gender balance to either share knowledge, or there may not be field workers that are comfortable enough to start the conversation and put themselves in a vulnerable position of opening up about their quite private bodily functions. So to build on that, I think it's important that we make practical tips for managing menstruation on fieldwork more available and kind of in sort of a one place. So this section of the talk is primarily aimed at sort of menstruating people as the options for menstrual products and extra medical supplies that you might want to take with you. But it's also for fieldwork leaders and non-menstruating people to be aware of, and also to help them to prepare group first aid kits and sort of think about waste disposal long term as well. Now, managing active menstruation is just one part of the equation. It's also important that field workers are adequately prepared with supplies for symptom easing as well, both in personal kits as also in general first aid kits. So I've listed some of the common symptoms here, but this is also very individual. So I definitely recommend, if there's something you will need adjustments for in your fieldwork, to speak to your fieldwork leader if you feel comfortable to do so, to ask for those adjustments in advance, as well as speaking to your medical provider as well. So some of the typical medications that we should see in fieldwork first aid kits are overall just general painkillers, particularly anti-inflammatory medications to help with cramps and other pain symptoms like headaches. It should be noted, if you are going to be taking anti-inflammatory medications like NSAIDs, to make sure that you're eating enough to line the stomach, as they can be quite irritating. And also to make sure that you are comfortable taking those medications before you go on fieldwork as well. So again, just discuss that with your medical provider. An important one to note is that headaches can be exacerbated by dehydration. So supporting your team in their wild weeing, providing comfort breaks, it will really help to encourage people to drink the appropriate amount of water, which will really help with those kinds of symptoms. I think everything in general is just made worse by dehydration, so we really want to be avoiding that as much as possible. Another common symptom is nausea and stomach upset, so providing enough food and snacks to allow people to eat little and often throughout the day is really ideal. It can also really help to have supplies of anti-sickness medication and anti-diarrhea medication as well in group first aid kits, and then making clear that those are accessible pre and during deployment from a designated person. Again, this isn't necessarily a universal experience, and other gynecological conditions can raise a lot of other symptoms that may need other management strategies as well. So things like endometriosis, adenomyosis, PCOS, all very common conditions, though very much underdiagnosed. So planning ahead with your medical provider is really important, especially if you are potentially worried about having one of these conditions or you are in the process of seeking a diagnosis. Before fieldwork, it can also be really helpful to research the options for menstrual products as well, and how disposal of these products or their contents will be managed in the field to allow people to make more informed choices for themselves. So, for example, if you prefer disposable menstrual products, then there's no reason to change that whilst on fieldwork. But you might want to bring your own supply of wet wipes, hand sanitizer, and tissues, along with a few Ziploc bags to facilitate changing pads and tampons in private. So I can't stress enough how important it is to be able to change these disposable products often, and this needs to be accounted for when planning a day's work to avoid potentially dangerous conditions, things like toxic shock syndrome and pelvic inflammatory disease as well, and that can occur from using these products for too long. So some privacy for waste bags, if Ziploc bags aren't your preferred method. Some other good options are dog poo bags, nappy bags, or you can even get specific menstrual waste bags as well. They can be a little bit extra useful. They're opaque. They're often scented as well for that little bit of added extra privacy. And some of them are also available in biodegradable materials as well, for those that are more environmentally conscious. And field trip leaders can consider having an emergency supply of these disposable materials available in their first aid pack. And then again, make that clear that these are easily available from a designated person during the field campaign. Reusable options are becoming a lot more commonplace. They can be a great addition to your personal fieldwork kit. They help to reduce waste and long-term costs. But I do recommend trialing these months in advance if you're not already a user and you plan on using them in the field. So menstrual cups in particular are becoming very popular. These are an intravaginal device and they're made from medical grade silicone. So there is less toxic shock syndrome risk compared to tampons, but this risk isn't zero. So do be mindful of that. Other advantages over disposable hygiene products is that these can be comfortably worn for up to 12 hours, meaning most field days can easily be achieved without having to change products. The length of time that you can wear the cup is going to be very dependent on how heavy your menstrual flow is. So different brands will have different capacities, but they can typically hold up to about 30 mils of liquid. So something to note is that if your cup does get full, it may leak. So some people with particularly heavy flows may also opt to wear liners or period underwear as backup as well. So do make sure that you are sort of providing options for yourself if you can. Menstrual cups do require a little more cleaning and care than a disposable product. So they need to be rinsed in a basin or sink twice a day between reuses. After each cycle, they also need to be sterilized using boiling water for about 7 minutes. So this means they can be used even when camping in the deep field. They don't generate any waste and they'll last you years if they're taken care of properly. And a fieldwork leader can make life a lot easier for people using this method by clearly providing and labeling a pan that can be exclusively used to wash and sterilize cups, and ensuring that people have the space and privacy to do that. Many people also swear by reusable and washable underwear. The advantage again is that they can be used all day without having to be changed and they don't contribute to any waste. You could bring multiple pairs with you to be used and washed over a full cycle. But once they're full, they will need to be washed thoroughly before they can be used again. They therefore may not be ideal in the deep field where there's no washing facilities, or if privacy whilst washing them is preferred. But you could potentially use them as a backup for other tools like the menstrual cup or tampons if that was a preference. All of these things require a little bit of preparation beforehand. So finding the method that works best for you may take a little bit of trial and error, so always bring backups. And again, make sure you're trialing these methods before you go on fieldwork. So because of the number of factors sort of around having to manage sort of different menstrual products as well as the disposal of different materials, the contents of menstrual products, people may opt to delay or prevent their period during fieldwork as well. And there are a few options for this, but you again should definitely discuss these with your medical provider. So none of this is to be taken as medical advice. I'm also going to preface this by saying we don't need to be medicating to make fieldwork more convenient. And actually, we should be making more adjustments for people to menstruate freely and comfortably on fieldwork first. But if this is a person's preferred route, then especially if they have troublesome periods that they want to manage, then there are a few options. So some of these recommendations rely on the ability to accurately predict the onset of menstruation, which will vary from person to person. So if you have a regular cycle, sort of the first and easiest option you have is to track that cycle and then plan your fieldwork around your period if you can. Now, I'm aware this is only really available as an option for a fieldwork leader, as well as those of us that aren't at the whims of the planning of other sort of organising bodies. So there are also medical alternatives to be able to alter your cycle as well. So if you're already on contraceptive medication, this may be the easiest option for you. So the progesterone-only pill, for example, can stop people's periods, but not everybody's. So do make sure you're trialing this well in advance. There's also still the risk of breakthrough bleeding as well. So discuss that with your medical provider and make sure you bring backups just in case. If you're on the combined pill, again, you can discuss how to take these back to back without your pill-free week or your placebo pill with your medical provider and how long you can take that for. That's another good option. Again, you may still experience some breakthrough bleeding, but it should help to really lower that if that was a concern for you. Then for people who are not on hormonal contraceptives, you might have the option of a period delay medication. So this is similar to progesterone-only pills, but at a slightly higher dose. To take this effectively, you do need to be able to reliably predict your period, and then you start this medication around 3 days before onset. So you can take this pill for around 20 days, and then your period should arrive approximately 3 days after finishing the course of the medication. A point about this pill is that you can actually take the medication months in advance of your field season when you have your fieldwork dates to alter your cycle for the future. So in those cases, you don't have to take it on fieldwork with you, especially if you're someone that might suffer from some of the side effects. Those potential side effects are things like headaches, nausea, stomach cramps. So taking some extra precautions against that is sort of really recommended. Also take extra precautions against the increased risk of blood clots in some of these cases. So wearing things like compression socks when you're flying, making sure you're getting in plenty of movement. This is especially risky if you're going to be working at high altitude. So something to really discuss with your doctor before you deploy. It might exclude you from using some of these methods. So do think this through well in advance. Another issue we should be made aware of in fieldwork is the potential lack of cleaning facilities and then the potential for irritation or even infection. So there's a few important things to note. The first one is that try and be sure to properly be emptying your bladder, which can sometimes be really hard and difficult, especially in those little pee bottles or if you're using a shiwi. So trying to get into those squat positions can really help to empty the bladder fully to prevent any kind of water infection. And then secondly, really try and keep up with a cleaning routine that works for you using things like wet wipes. Ultimately, sometimes irritation is unavoidable, especially for particularly long stints with no washing facilities. So having some creams and treatments on hand is a really good tip as well. And then I think the most important thing here is that cultural change is going to be a big factor in fostering an inclusive environment in fieldwork. So we need to be sharing best practice among field leaders to ensure that they're able to support their peers, their mentees, and their students. But this should be formalized where possible, so into things like risk assessments and standard operating procedures to encourage equal opportunities rather than the luck of the draw situation, where less experienced field workers are really dependent on more senior members initiating open and frank conversations around toilets and periods. So this will obviously all take time and require an overall cultural shift in what topics we find embarrassing and taboo. So we need to be making people feel safe to disclose and have those conversations without fear of discrimination and judgment as much as we can. Ultimately, by creating a more welcoming environment and providing reasonable adjustments, we will see better retention of menstruating people in the future. So to round up the main advice here, fieldwork leaders can actively support their team by providing adequate briefings of toilet facilities before fieldwork and sharing resources around the toilet and hygiene facilities that might be available. So things like preparing a fieldwork first aid kit, fieldwork leaders could consider and provide for menstruating individuals by packing disposable sanitary products and appropriate medication to relieve menstrual symptoms. And then discuss medical care and options with field teams prior to deployment with sort of the usual health and safety field checks. And then regularly check in with your team during fieldwork as well. For fieldwork attendees, make sure you familiarise yourself with the toileting options and the waste disposal. It might also be worth sharing resources and blog posts about some of the hormonal options for managing menstruation as well. We do need to be careful that any of this information that we do provide to field teams is, again, not seen as medical advice. And we should be encouraging people to speak to their medical provider if they can for more bespoke advice for their needs. But overall, this can all be better supported by providing toilet and menstruation related training and guidelines before deployment, and then just keeping these discussions going before, during, and after fieldwork to try and combat the fact that this topic is really seen as taboo in sort of general society, not just in fieldwork settings. So I'd just like to thank COMNAP again for inviting me to give this talk, and I'm happy to answer any questions as well.
Thank you very much. I think you can hear the clapping everywhere. And thank you very much for your very interesting and also inspiring and very useful speech. I hope we will have this presentation also for us in COMNAT Library to share it maybe somehow and to make it possible to translate to various languages also and so on. Thank you very much. And now I would like to ask if you can stop the recording for the